bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Thank you for joining us. I'm smiling because our nice guest here has a name I'm having difficulty pronouncing.
Saurabh.
Saurabh?
Yeah, Bajaj.
Bajaj. Okay. Nice to have you, Saurabh.
Nice to have you.
All right.
Thank you.
He's Director of Development for the Asian Pacific Islander Wellness Center in the city. And the Wellness Center, I assume, from what we talked a little bit before, is dealing with the physical and mental health of the community.
Mm-hmm. Yeah, we're a health services, education, public policy, and research organization. We mostly focus on HIV/AIDS among Asian and Pacific Islanders. HIV remains a huge issue in our community, so we're there to help.
Are you dealing with the young people, or all ages, or how does that apply to the population?
Mm-hmm. All ages. We do focus on adults, gay and bisexual, transgender folks who are at highest risk for HIV. And also young folks. In the last few years, HIV cases among young gay and bisexual men have doubled. And even women, they've seen a 14% increase in HIV infection. So it remains, a pretty big issue.
You mentioned something that I think that most people don't realize, that how many women have been developing HIV.
Yeah, it's definitely, there's a lot of silence and stigma in our communities, and we don't talk about who is getting HIV, and again, that includes women, young people.
Yeah.
And again, gay and bisexual and transgender folks.
Over the years, when this first started, when this originally, we started hearing about this, people had no knowledge and there was no information out there. But it seems to me that I've heard a number of times that even though there's been information, even though it's out there, it's still increasing. Is that right?
Yeah,
is that right?
It is, yeah, it's increasing, definitely. And I think one of the issues that we face that we're trying to address is stigma in our communities. So there's so much silence and shame around sex. When I was growing up, my parents never talked about sex. My mom said once, she said, there's a clean way to do everything. Who knows what that meant, right? But when
actually, that's kind of a nice philosophy, That's
when I came out, we finally started talking about sex, sexuality, and HIV. And, now she asks a couple times a year if I'm being safe. And as much as you don't want to have those conversations with your parents, it's probably some of the more important ones we have. And so we see that, across our communities, that there's this issue of again, silence and shame, of saving face. That's a, kind of notion common among A&PI communities, is that if you talk about HIV, if you get tested, that'll bring shame upon your family, upon yourself. So on May 19th, it's our National A&PI HIV/AIDS Awareness Day. And the Awareness Day is really to, again, bring up some visibility in our community, that we have to start talking about HIV in our communities
Okay, we've got HIV, and then we get into full-blown AIDS. And what is the situation with that? In terms of increase, or has the medical advance been enough to keep people not from going that far?
If people, if people test early enough with and get their HIV, they find out they have HIV, you can get on treatments and people can stay healthy for a long time. But what we're seeing is that, especially for immigrants, people who don't speak English very well, are having a hard time accessing care. And again, with the stigma, so they're afraid to get tested. So we have people who actually come in so late to get tested that they actually do have full-blown AIDS. And people have passed away recently too, and they've come in so late into general hospital. We get a call for them, and by the time we get out there, we had a client or a person who had already passed away. So it is really about, again, talking to each other, making sure that we know that there are resources out there to get tested, and that, if you have HIV, you should not be discriminated against or have any shame about it.
And there's another issue too, and that's financial. I mean, if someone develops full-blown AIDS, and to stay alive and to stay with them, it's it's thousands and thousands of dollars. Most people can't afford that. Is there money available to help people like that?
There's drug assistance programs like ADAP, AIDS Drug Assistance Program, the state runs. There are a lot of benefits, but a lot of people don't even know how to navigate that system. So, we have case managers who can help find your benefits and help you sign up for ADAP or, Social Security and stuff like that. So, but you need that guidance. Especially as someone who, again, doesn't speak English well, or is an immigrant, they face different issues, and that's why A&PI wants us around, so we can help our own community.
Okay. All right. So if people want to get more information about this to protect themselves, it's the Asian and Pacific Islander Wellness Center in San Francisco. Saurabh, thank you very much for being here. I appreciate it.
Thank you.
Okay, and thank you for watching.